Why are surgical margins important after prostatectomy for recurrence? Imagine removing a cancerous prostate and hoping all the cancer is gone. But sometimes, cancer cells can be left behind at the edges of the tissue removed. These edges are called surgical margins. If cancer cells are found at the edge, it's called a positive surgical margin. If no cancer cells are at the edge, it's a negative margin. This detail is very important because it helps doctors predict what might happen next. When the margins are positive, it means some cancer may still be in the body. This increases the chance that the cancer could come back, especially if the prostate-specific antigen levels start to rise again. Prostate-specific antigen is a protein made by the prostate, and higher levels after surgery can suggest the cancer is returning. Studies show that patients with positive margins are more likely to experience this biochemical recurrence. In fact, they can be up to 5 or 6 times more likely to have a recurrence within the first year after surgery compared to those with negative margins. The size and extent of the positive margin also matter. If the cancer cells are found along a long stretch of the tissue edge, the risk of recurrence is higher. Larger or more extensive positive margins often mean a worse outlook and may lead to additional treatments like radiation therapy or hormone therapy. But it's important to remember that not everyone with positive margins will experience a recurrence. Other factors, such as the cancer's grade and how far it has spread, also influence outcomes. Surgeons face a challenge when removing the prostate because it is surrounded by important nerves and structures that control urinary and sexual functions. They try to remove all the cancer while preserving these functions. Achieving negative margins is a delicate balance. Sometimes, to ensure all the cancer is gone, a wider removal might be necessary, which can increase the risk of side effects. Knowing whether the margins are positive or negative helps doctors decide what to do next. If margins are positive, patients often need closer follow-up and may be offered additional treatments to lower the chance of the cancer coming back. If margins are negative, the risk of recurrence is lower, and further treatment might not be needed right away. In summary, surgical margins are a key piece of information after prostate removal. They tell us whether cancer might still be present and help guide future treatment decisions. Positive margins suggest a higher risk of recurrence, so careful monitoring and possibly additional therapy can improve long-term outcomes. Always remember, each person's situation is unique, so discussing your results with your healthcare team is essential for personalized care.